staff at UFCW Local 21, last name spelled Cherin. We are here to raise our voice of concern about the situation at St. Michael's and the recent COVID outbreak there. For months, we have been trying our best to improve the situation. We have worked within the system. And as recently as yesterday, we were on calls with the Department of Health, Kitsap Public Health, and we do not believe that CHI Franciscans, DOH, or Kitsap Public Health have been doing enough to protect workers and patients, and we will get to that shortly. We have several people here to speak today, and then we will take questions. Faye Gunther is the president of UFCW 21. Cindy Frank is one of our member leaders and a nurse at St. Michael's. Rob Schauger, one of our leaders and a CNA at St. Michael's. He just got off a shift. He works the graveyard shift, so you may see him yawning. And State Senator Emily Randall. We will hear from each of them and then open up to questions. And we will keep this relatively brief for all of our benefits. There are many concerns we want to raise today, and I'm going to have Faye Gunther, the UFCW 21 president, start us off. Thank you, Faye.
Thank you, everybody. And I especially want to thank the members who are joining this call. My name is Faye Gunther. I'm the president of UFCW 21. We represent over 46,000 frontline workers across Washington. Our UFCW members are in jobs at hospitals, clinics, grocery stores, retail stores, pharmacies, and food production, as well as many other industries. On a good day before the pandemic, frontline workers did everything possible to serve the needs of their patients or customers and try to do so in a safe and efficient manner, often overworked and underpaid. Our members have been advocates and fought on issues such as passing paid sick leave in 2016 so that workers could stay home when they were sick and not spread illness. That is just one of the laws that better prepared our state for this horrific pandemic. Many people are hurting now. This is a difficult time. And these hospital administrators and CEOs are not making things better by ignoring workers who have been raising concerns since the day COVID started in our state. Since the pandemic began, most of our members have been on the front lines, and we have been raising the alarms about risks from the pandemic and trying our best to get companies where our members work to be more proactive on safety and to better protect workers, customers, and patients. Here at St. Michael's, known as Harrison, we have been filing DOSH complaints since March, repeated complaints. There is failure to be shared here between hospital CEOs, the Department of Health, and the Hospital Association, who has tried to maintain control of the conversation about personal protective equipment, attempting to block or blur concerns of workers. All of this refusal to listen to frontline workers has put workers and their communities at risk yet again. If you recall, these CEOs and the Hospital Association are the same folks who opposed giving workers adequate breaks and rest periods just a few short years ago. This outbreak was a choice to not invest in PPE and worker and public safety. It was a choice to ignore workers' concerns. The case of St. Michael's, known as Harrison, is a case study of one of the ways we continue to see major problems and the severe consequences of these ongoing problems. Several years ago, as you may remember, CHI Franciscans took over our local Bremerton hospital. We were told, essentially, trust us. This will be good for the community. They then cut staffing and also proposed closing Harrison altogether. Again, CHI tells us this is all for the best. And the public should know, CHI is aggressively attempting to expand to many communities and bring this same anti-worker, pro-profit to a hospital near you. Do not listen to the false promises made by CHI. See this as a case study in why these mergers hurt workers, patients, and the community. While we have raised concerns directly with management as well as the state about safety and staffing and PPE concerns repeatedly since the middle of March, we have seen these concerns go unresolved. I have lists of complaints we have filed and conversations we have had. This virus is killing people, and we are concerned that inaction by management at the hospital are also partly to blame and will continue to cause future risks to workers and to the communities in the coming months. I just want to share a few of the This is a brief list of workers' outreach to our employers and to the state officials, and I want to share a few of them with you. March 17th, we filed, the hospital was requiring continued use of damaged face masks, and they were telling people to fix using tape to fix the cracks, to cover up the cracks with tape. April 6th, we filed a complaint for the hospital not providing appropriate PPE. August 12th, failure to notify healthcare workers of known exposures. August 18th, safety concerns because during aerosol generated procedures, rooms, the doors were left open. Cleaning processes in COVID rooms was not adequate. Our union, along with community partners, had to donate N95 donation masks in March because there was not enough personal protective equipment. We had meetings with Vice Admiral Bono. We discussed workers at Harrison wearing damaged masks as a result, and that the employers were not adequately reporting their PPE appropriately. We met and talked about a dashboard report, which showed Harrison reporting 700 pieces of PPE that were in conflict with what they were reporting to the hospital. So not transparency into what was actually happening with the personal protective equipment. And the list goes on. And then when we're specifically talking about this Harrison outbreak, we know August 10th, workers had direct contact with the patients and that the workers were not notified. This is just unacceptable that workers are not notified when they're exposed. We also just want to share one other thing, which I find incredibly appalling and just an example of how CHI treats their workers. On August 19th, agents in hazmat suits with CDC across their chests were on site in the Bremerton hospital performing an investigation. Patients, workers, and the union were not informed of this inspection. So this lack of transparency and this inability and unwillingness to invest in personal protective equipment is putting our workers and their communities at risk. So I want to thank people for joining us on this call. We need our hospitals to do more, and we need our public health officials to hold them accountable. Our very lives depend on it.
Thank you so much, Faye, for those words. Now we're going to hear from Cindy Frank, a nurse at Harrison.
Good morning. My name is Cindy Frank, that's spelled C-I-N-D-Y, Frank, F-R-A-N-C-K. I'm a nurse at St. Michael's, what we always called Harrison Hospital. I've worked there for 20 years. I'm also a union member of UFCW 21, and over the years have been part of our active union, taking action with my coworkers and with the support of community, as together we have helped gain better contracts for wages, health care, and improved our working conditions. Issues of safe staffing levels have increasingly been issues here at Harrison, and from what I hear, at many other hospitals and clinics around the state. Since March, when COVID broke out and struck our communities, we've been trying our best to serve the needs of our patients, but we've been fighting an uphill battle. We've filled out safety complaints, we've called out for proper PPE, we've taken donations from other unions. Recently, it seems like things have been getting worse. For example, without any explanation for why, we were told that our nurse and CNA patient to staff ratios were going down. So some units went from a 3-to-1 ratio to a 5-to-1 ratio, and the CNA ratios also went down. More patients for each nurse, more patients for each CNA. This would be a problem under the best of circumstances, but these are not those times. Our patients are being told that they only can have one visitor per day. One visitor, not two visitors at one visit, just one visitor for the entire visiting hour shift. This puts a lot of extra stress on them and on us. We want to serve all of our patients' needs, their physical body, but also their mind and their spirit. This higher ratio makes that all more difficult. Despite all this concern raised, here we are today. Over time, CHI has failed to adequately respond to our concerns. We are still in situation where workers are wearing taped up plastic face guards. We are in situations where I don't feel we have enough N95 masks to be safe. This is one of the wealthiest nations on earth. We have the most expensive health care in the world. We have had more deaths than any other nation on earth, and we are wearing taped up protective gear after 5 months of this pandemic. This is unacceptable and a serious problem. How many times do healthcare workers need to cry out for proper protective gear before things change? How many times must workers raise concerns that are not proper safety protocols in place or being followed before things change? How many times must workers raise concerns that there are needs for more staff assigned on certain shifts to adequately cover patient needs and to be able to respond to staff calling in sick before things change? How many times must we be kept in the dark or misinformed by officials at our hospital before things change? How many times are we going to be told that we are getting tested and have to wait for days to get results, and at the same time keep coming to work when we are asymptomatic, even though we know as healthcare professionals that being asymptomatic does not mean that we don't have the virus? How many patients across the nation need to die before our hospitals make changes? Lastly, right now we need to focus on this emergency, getting our test results back, making sure everyone has leave so they can safely quarantine and prevent further spread, and dealing with the impact of this outbreak on staffing levels so our patients stay safe. But I want everyone to know, next time healthcare workers or any workers are speaking up and saying that it is not safe during this pandemic, everyone needs to listen. We've been sounding the alarm for so long, and now our community has been put at risk. Thank you.
Thank you so much for your words, Cindy, and a good reminder: when workers speak up, we should be listening. Rob Schauger, let's hear from you.
Hello, my name is Rob Schauger. It's R-O-B, last name Schauger, S-H-A-U-G-E-R. I'm a certified nursing assistant on the surgical department at Harrison Medical Center, which is now St. Michael's, and I've worked there for 21 years. I am a member of UFCW 21, and I've been an active member for all 21 years on the bargaining team for my bargaining unit. I wasn't supposed to speak today because I work overnight. I work graveyard shift, and I actually was sleeping, and they called me in to ask me to help with this. I'm tired, but my coworkers come before I come because I like to think that I'm an advocate for safety at our hospital and help them. My coworker was supposed to speak today, but he is in the ER right now. He is tested positive for COVID-19, and he is actively in the ER right now with breathing problems. So he couldn't be with us today. So I'm speaking on his behalf, and that's why I'm stepping up and going on no sleep early right now. Can you imagine how frustrated and upset that our coworkers, patients, and families are about this risk at this time? I tested for my COVID test on Thursday last week, and I just found out this morning my test was negative. As part of my whole floor, after the patients and staff have been tested positive, and I didn't get my test back till this morning, and I actually have to get retested. I'm sorry, I'm just kind of like out of it a little bit here because I'm sorry if this is like broken up because I'm just
fine, Rob. It's perfect.
I need to get retested for my thing. I'm on a weekly retest now, and I have to get tested again on Thursday. And I do a lot of community things, and I don't want to get anybody infected. And that's why I think that we need to go to rapid testing as soon as possible for our hospital and for our staff. If they can do it for the patients, why can't they do it for us? I know that there's limited testing, but I think that we being the frontline workers and being the people that are in the actions. I work with, like last night, we have 22 patients on my floor, and I worked with all 22 in some part of the day. I go help turn people. I have to do vitals with people. So I'm interacting with 22 patients on my floor, plus the nurses. And we're kind of working short now because of this pandemic. There's like 26 people on my floor that are out right now with exposure. They might not have the COVID. They're being tested, but they're on the 14-day exposure thing right now. So we're working short, and, I'm putting my all into it. Recently, I've spoke out about publicly in the media about a month ago. We did a caravan, and I spoke out about proper PPE and how we didn't have it. And I've been asking, I'm on the bargaining team, and we're in the middle of a contract negotiation. And every time we bargain, I ask about them updating the COVID list and the PPE list. There was a time that the PPE list, that they're saying that how much PPE we have for our hospital wasn't updated. And they're just now starting to update that, because every week I ask about it, because there's a concern about the PPE. We've been bargaining for months now, and we've been trying to get it so we can help be part of this plan. When this exposure happened, we're trying to become where we can work with management so we can get the inside track on this, so we can help them as an employee to try to help the other employees understand what's going on. I'm kind of left in the dark with a lot of this. And, it's scary sometimes, because you don't know what management's thinking. And, and we have to just kind of assume what we're getting with the emails. We get an update once a week, and it's kind of tough to go off update once a week. I mean, it's really tough. And so, we're dealing with potential exposures every day with the hospital in the way that it is. Also, like I said, we've been short staffed. And like I said, we've done some actions over the last couple of weeks. We did a thing where we actually sat on the Warren Avenue Bridge and held up signs. And we've been at the bargaining table, like I said, and this is just a pandemic, and I'm just scared for my coworkers, and I'm scared for myself, kind of thing. Like I said, I'm tired. I'm really sorry about this.
That's okay.
I really never liked this. So
thank you so much, Rob, and Cindy. And Rob, we know you got your negative test results back just this morning. And I know, as someone who's in a high risk category, you were waiting on those results, worried about your health and your family's health. And you didn't get those until just this morning after being tested on
Thursday, sorry.
Okay.
It was Thursday.
Thank you so much, Rob. We are also joined today by State Senator Emily Randall. Before she speaks, I just want to call out the great support and advocacy we have had in our partner, Leslie Doggs of the Bremerton City Council. She has been standing with us. She is standing with us and is a strong leader in working to keep the pressure on the hospital and working to keep our community safe. So thank you, Leslie, for all the work you do. Senator, please go ahead.
Thank you, Sarah. I'm Senator Emily Randall. That's EMILY-RANDALL. And I represent the 26th district here in Bremerton, as well as Port Orchard, Gig Harbor, and the Key Peninsula. And what I want to call out is that all of us have said, and not just those on this call, but all of us in our daily lives over these last 6 months, that our healthcare heroes are on the front lines of the epidemic. And it's true. Day in and day out, the staff at St. Michael's and at hospitals and clinics across the state and around the world are providing life-saving care. They're dealing with emergent healthcare needs, repairing my grandpa's hernia in April, delivering babies, treating broken bones of adventurous kiddos trapped inside, and caring for patients with chronic illnesses who cannot just stay home in order to stay healthy. And they're doing it all while battling the highly infectious coronavirus. The doctors, nurses, CNAs, respiratory therapists, dietitians, kitchen workers, housekeeping staff, like my grandma was at Harrison for 20 years, they have bravely donned their uniforms, their scrubs, their masks, and stepped up to take care of our communities when we needed them most. They've gone above and beyond, holding drives to collect donated personal protective equipment in March when the hospital supply chain wasn't up to the need. Our healthcare workers, our frontline heroes, are bravely using their voices to demand change to a flawed system, a system that has failed workers, a system that has failed patients, a system that has failed our community. Our healthcare workers are asking for transparency. They're asking for sufficient testing and contact tracing. They're asking for assurances that exposed workers, until they receive a negative test result, will be able to safely quarantine. They're asking for safe staffing levels. Our frontline healthcare heroes are using their voices to tell us what they need to do their job safely, to care for their patients safely. The outbreak at St. Michael's puts not only the staff and the patients in this hospital, but in our entire community at risk. We know the reality of community spread, and we know that it is essential that our frontline workers have the tools and the information that they need to safely treat our patients and protect our community. If we listen to their voices, the voices of our frontline heroes, we can keep our community safe, and we will. I have faith that this powerful group of workers will be heard. Thank you for letting me join you today.
Thank you so much for those words, Senator Randall, and for being a champion for healthcare and our healthcare workers. Thank you. I want to wrap things up with just a list of demands, and you've heard most of them today before I take questions. And I'm going to ask reporters to raise their hand in the chat, and that's how we can get to you in asking questions. We know that Kitsap Public Health is on site today at St. Michael's testing workers. We want to be encouraging that all workers should be getting their test results rapidly and quickly. 24 to 48 hours seems more reasonable than 72 or more. We want 8-hour notification of potential exposure, as outlined in an existing COVID agreement we have with St. Michael's and CHI. Paid administratively after a COVID test until we get our results, regardless if we're asymptomatic at the time and during the full length of quarantine. We want to maintain safe staffing levels. We need to know that community is getting safe care, even in these emergent circumstances. Adequate PPE for all workers. We have been bringing this issue up for March, and finally, we hope it gets the attention that it needs. I'm happy to open it up for questions now. If you're on the phone and you press *9, that's the way that you can raise your hand. So I'm going to go to the participant list, and I have, yes, Keith. Keith, we'll go to you first. And just again, let's get you on. Keith, are you there?
I am here.
All right.
Just checking to see. So the medical director for CHI was talking to us yesterday along with the health district officer, and they say that they can get this under control. What's being done? Do you believe that we'll get this under control? And it sounds like they have it all the way back to one staff member infecting everybody. What's the response to that?
Yeah, thanks for that question. Cindy, do you want to answer this? Oh, you're on mute, Cindy. Take yourself off mute.
Can you hear me now?
Yeah.
Okay. They shouldn't be scapegoating a person that works at the hospital. It should be assumed that if we work at the hospital, that we got it there. You can't just say that we got it in the community. You can't pinpoint it to just that. They opened up the hospital to visitors, so they can't be just blaming one nurse. That's super unfair, and it's really frustrating. And they didn't tell the rest of the staff for several weeks that they had positive staff members that came to work because they were told to, because they didn't have symptoms.
Faye, do you want to follow up on that?
Yeah, I just want to add, regardless of whether one person tested positive, that spread throughout the hospital, and it's partly because there's a lack of reporting on when people test COVID positive. There's a lack of transparency to the workers. The workers not getting that 8-hour notification that they should be getting. So regardless of how it started, it's spread now to 33 people, and who knows how many more. You heard Rob's story about his friend who's in the hospital who can barely breathe. This hospital has a history of not being transparent with the workers and with the union. We did not, like I said in my remarks, workers realized there was a problem when people with CDC across their chest showed up. We should have been notified about that. The workers should have been notified about that. Your question about whether we think they can get it under control. Well, the first step to getting things under control is making sure workers get tested quickly, making sure that everything is traced correctly, and then making sure they're listening to workers when they've raised concern after concern after concern, filed DOSH complaint after DOSH complaint after DOSH complaint. This is a pattern from this hospital of refusing to listen to workers. And that's where that is the root of the problem. And putting profits before investing in personal protective equipment, putting profits before making sure everyone has the personal protective equipment that's not cracked, that's not taped up, all of those sorts of things. So I'm sure they're saying they're going to get everything under control because it's probably, it's upsetting to have this break out happening, and it shows that they're not following protocol correctly. So I'm sure there's an embarrassment factor. I'll believe it's under control when they start listening to the workers and start working with the union and make sure there's rapid testing and making sure that there's reporting within 8 hours. I'll believe it when I see it.
Thank you so much, Cindy, and thank you so much, Faye. Okay, I'm going to go, and please, reporters, identify your name and where you are from. So I'm going to go to Ryan Blethen from the Seattle Times. Ryan, are you there?
Yep, I'm here.
Okay.
Can you hear me?
Yep.
Yeah, it's Ryan Blethen. I'm with the Seattle Times. I wanted to ask, at a press conference yesterday, they said that Dr. Anderson said that all employees are being screened. And I'm curious what that looks like and how that screening is taking place. Is it something you're just kind of self-reporting, or are they, meeting you at the door and screening you before you come in? And this follow-up or second question is, are patients who are COVID positive being at any time for the past couple of weeks been sharing rooms with people who do not have COVID? Thanks.
Okay, thank you for your questions. Cindy or Rob, do you want to take the first one about the screening process?
So are we talking about how we get screened when we come to work? When we come to work, we have to come in through a certain door and we get our temperature taken, and they ask us certain questions. Do you have any symptoms of COVID? And we say yes or no. We use hand sanitizer, and if you don't have a mask on already, you get a mask, and I make sure my eye protection's on as soon as I walk in the door. So I have my mask and my eye protection on when I get to the door. I use hand sanitizer, and they actually tell me my temperature. And if it's over a certain amount, they're supposed to send you home. And then the second part of the thing, if you're asking about how they're doing the testing right now, they have started testing. They have employee health that everybody in the hospital is being tested now as of today, or as of today. They started a new drive up thing in the Bremerton ER garage kind of thing. So if you are on the 14-day list where you've been exposed but you don't have it, or you have to do it, everybody can go through a drive-through now, and they're testing people, doing rapid testing they're doing testing actually through our garage downstairs. And I think they're doing it in Silverdale also, but it did start today, and they have assigned floors that they want to see on that day.
Thank you, Rob. And we haven't gotten a commitment, to Faye's point. We have not gotten a commitment on whether or not those results will be given rapidly, or whether or not people are going to the tests are being sent out of state to labs and will take longer to process. So we are still waiting to hear that. The silence has been deafening. On the shared rooms question, I think we want to be careful, given HIPAA violations. So I think we'll politely decline that one. Okay, now I have I actually have Austin from the Kitsap Sun. I'm gonna, and please identify yourself just again, hold on. All this new technology. Austin, are you there?
Yep, this is Austin Macklis from the Kitsap Sun. I'm curious for Cindy and Rob, when did you folks, when were you first notified that there, was an outbreak at the hospital, and how were you notified? And what instructions were you given in discussing that with patients who were under your care at the time?
Thank you for that question, Austin. Cindy, you're on mute. Why don't you go ahead and take this?
So I actually found out secondhand in the middle of the night on the weekend of the 15th from another staff member that because I was going to assign a nurse to go down to a floor that had the positive patients and the positive nurses, that once they floated down there, they were no longer to be coming back to my floor. So when I asked the question, why, it was pretty much silent. So I know that they reported yesterday in their CHI said that they knew on August 4th that a staff member was positive, but we didn't catch wind of it until about the 17th.
Thank you so much, Cindy.
Can I answer that real quick?
Go ahead, Rob.
My two brothers live in Marysville, and they were watching the news. They were at my brother's house, and they saw it on the news. And they instantly called me because I had seen them on Friday, and they were concerned because they actually, they had come down to Bremerton from Marysville to see me, and they were concerned. And they saw the breaking news story and called me, and I didn't even know about it. I had to look at the news and look it up on the thing. I was like, whoa. So that's how I found out.
Wow. Okay, thank you so much, Austin. I am now going to go to Richard Davis. Please identify what outlet you are with, and I'm going to put you on mute, take you off mute. Are you there with us, Richard?
I am. Thank you very much. This is Richard Davis. I'm with Wake Up Bainbridge Online Broadcasting. Looking at the Kitsap District Health timeline that they released yesterday, it appears that they designated the hospital an outbreak as of August the 14th. Didn't make a notification to the public until August the 21st. At some point during this time frame, it looks like there were elevated visitor regulations and requirements. Does anyone know at what point those were instituted at the hospital? I'm mostly concerned, obviously, about people coming in and out for short procedures or visits, et cetera. And at what point it became clear that there were elevated restrictions, what date that would approximately that would fall into.
Cindy or Rob, can you recall that? If not, it's okay.
Yeah, I want to say that it was Monday the 17th, but if it wasn't that day, it was one of those, the 3 days after is when they limited visitors. They stop visitors, but they have certain requirements if, that they allow them. But to the public, it was that week. I think it was the 17th.
Okay. Faye, do you want to just comment on the gap between,
Well, I was going to actually say, Stacy, I don't know if she's available. She has a timeline that she's put together around a lot of the stuff. And so I don't know if Stacy wants to add anything here.
Yes, so I believe Cindy is correct. Hospital stated August 4th was when the first outbreak was. I don't know if they reported that to the public health as they should have. And then August 17th is around the time that they decided to share the notification with staff on what was going on. I don't know about the public, if they were notified or visitors or patients that came in. Unclear if those notifications went out or calls were made to anyone, and how they trace that, or if they trace that.
And one thing I'd note on that is, if you're out in the community, if anybody reads, we want to talk with you. We would like to, build an alliance with the community around this issue. Workers and the community deserve full transparency about potential exposure. That's one of the ways you slow the spread of COVID-19. And so anybody who wants to be working with us on this issue of transparency, we need your help. Harrison and CHI is a huge corporation. They are very hard to hold accountable. They have a lot of money, and they have the hospital association protecting their interests. And we fight all the time to try to increase transparency. And we would like as many community partners to help, because when workers are safe and there's transparency with workers, the community is safe and there's transparency with patients in the community.
Thank you so much all for that. It's clear that there's a gap between when the hospital knew there was an exposure and when they notified workers. I think is the larger story here. Okay, I'm going to go to John Ryan of KUOW and then Deborah from the TNT. So hold on one second. John, are you there?
I am.
Okay.
Great. 2 questions about PPE. Health department data shows that I guess the hospital is reusing a lot of its PPE from one patient to the next, which I assume would be a big risk for COVID transmission. Can you tell me the 2 workers on the line if that's what you're having to do right now? And then secondly, I wonder, it sounds like you're faulting the hospital for the PPE shortages when we've all heard it's really a national problem. So do you think that's fair, or is it somehow worse at your hospital than elsewhere?
Cindy and Rob, go ahead, and then maybe Faye.
Well, I would say that we plan for disasters. We should be 50% ready for any disaster. When this happened, we weren't even 50% ready. So, I mean, we broke all of our PAPRs in the first weekend, on the first day that we, had the COVID unit. The manufacturer didn't even make the guards on the front of them anymore. I mean, that should be all kept up to date in preparation for any disaster. We should have masks. We should have N95 masks on every floor, just in case. COVID is one thing, but we take care of tuberculosis patients. We have respiratory MRSA patients. So we need those available. We should be fit tested. We shouldn't just, have to worry about that in a crisis. I mean, that's not the way you prepare at home. You would prepare for something to happen financially with, your food supply. So the hospital should be way more up on that than us. We should at least have protective equipment that works and that protects us. And we should have a plan in place. And we should be able to follow that plan in the event of a disaster. Yeah, we probably would have ran out, but we were also getting donations from other unions brought to our front door. The Carpenters Union and the Painters Union donated masks to us, and 95 masks. They disappeared. We didn't even see them. I just now saw them on my floor up in the cupboard. So.
Thank you, Cindy.
Yeah, I mean, it's a crisis, but we could have prepared and been a lot more prepared than we were.
Faye, do you want to comment on the lack of national PPE?
Yeah, I think that there's blame to go around on the shortage of personal protective equipment. We've been trying to raise the red flags on this since the day the COVID-19 pandemic started, and we had workers having to wear garbage bags and those sorts of things. The federal government has failed in ensuring personal protective equipment arrived in the state of Washington. And as a nation, we haven't done the best job of ensuring personal protective equipment is made here in the United States. Those are big global issues around ensuring personal protective. We never get into this situation again, and personal protective equipment is made here in the United States so that we have direct supplies to it. So this is a bigger problem. But specifically at Harrison, workers have shared story after story around the supply chain. One person working down in the distribution center where there's supplies, but they're not getting out to the workers on the floors. There's also been disparity between what Harrison wants to state is they have so that they can open up their procedures, their profit-making procedures. So they had to prove they had enough PPE. So they're reporting they have enough, but then the workers on the ground not getting access to it. You could Cindy's story about not being able to get access to masks. And 95 masks. So there is a lack of transparency in where the personal protective equipment is being held, who is distributing it, how much workers actually are getting access to. And so it's a very, there is murking. You cannot see into the system. They are hiding where this personal protective supply chain is existing and going. And also everybody could have done, and I'm not just talking about CHI, I'm talking about Providence, I'm talking about Multicare, I'm talking about other facilities as well. Investing in personal protective equipment is something that they could choose to do over taking a ton of profits. There's a ton of profit built into this model, into this healthcare model, and it's choosing to not invest in the personal protective equipment that has caused some of the issues we're facing, but all of the healthcare workers in the state of Washington, especially CHI.
Thank you so much, Faye. I think the theme we're getting is there's a tale of two stories. They may be telling the state they have enough PPE, but that is not the experience that workers are having. Okay, now I am going to go to Deborah from the TNT. Deborah, are you on with us?
Hello, can you hear me?
I can.
Okay, so talk a little bit about concerns you may have for CHI Franciscan properties in Pierce County. I'd be curious to think if you're worried that a similar situation could happen at one of their facilities there.
Faye, do you want to talk to that?
I mean, I can quickly state this, and Rob and Cindy, please jump in, or Stacy. We're worried about any healthcare facility who refuses to be transparent with workers, who refuses to listen to workers' complaints, where we've had to file multiple DOSH complaints, and where we're getting a lot of complaints from workers, and that's happening at many different work sites around personal protective equipment. So we're worried outbreaks like this will occur again and again unless there is a new path forward where workers' concerns are listened to. And so, yes, we're concerned about CHI and other facilities within CHI. We're also worried about other healthcare systems like Providence. We have reams of reports, hundreds of workers who have submitted reports to our safety report at UFCW21.org. I mean, dozens and hundreds. And so we're worried this could happen anywhere, anytime workers are not listened to and are not at the center of helping make decisions. These kinds of outbreaks could occur.
Thank you so much. Actually,
well, I can tell you.
Oh, 1 second. We have on the line actually one of our members who has used PPE for over 2 weeks. This is not an old news story. This is happening currently. So Ona Burkett is one of our members. She's on. Ona, I'm going to take you off mute. If you could tell your story quickly so people can hear it. And again, spell your name for folks. So hold on 1 second. Technology, I apologize.
Sorry.
Ona, are you there?
Yeah, my name is Ona Burkett, spelled O-N-A, and Burkett, B-U-R-K-E-T-T. So I'm a UFCW member, 21 for 17 years. I'm an emergency room tech. And questions that have came up on multiple occasions in all different areas of protective and route of transmission for this virus, of how we're going about and how we're protecting our employees. A good example, in our ER, on many occasions, and I work in the Silverdale campus mostly, but sometimes in the Bremerton, just to kind of clarify, just to give you an idea, we have now to the point the doctors have bought their own PPE and nurses buying their own PPE to be able to use, because we don't have an adequate supply. Where we have our face masks, because we're made to feel guilty that we're using more than we should. And the guidelines that we have right now, where before COVID is you would use one mask per patient, but now we're using for multiple weeks. And I even just recently, a story from L&D was stating that she's only had one N95 mask, and their masks and their PAPRs are broken, and they've made many attempts to try to fix them, but there's not adequate, and they're not even being tested, those PAPRs, to make sure that they fit properly and that they do work. So it's overwhelming, the stack of list of things that we could be way better at being able to advocate and be able to protect our patients and ourselves.
Thank you so much, Anna. I appreciate you getting on with us and telling us your story. I'm going to go to Michael. I'm not sure with what outlet you are. If you could identify yourself and tell us. Are you on?
Hi, do you have me?
I do.
Good, thank you. Can you see me? I'm sorry, I'm remote here.
Okay. No, Michael, with what news outlet are you with?
With King 5.
Okay.
So just a quick question here, but and I think you might have addressed this a little bit. I've been kind of popping in and out here with some signal issues, but yesterday we heard from hospital officials that there may have been some folks that returned to work after being notified about an exposure while they were in the testing process. Can you just talk about why that happened and why those people were making the choice to continue working if they were concerned about an exposure?
Yeah, absolutely. Rob or Cindy, do you want to answer this? You're on mute, Cindy.
Can you hear me now?
Yeah.
Okay. I can't speak to those exact people, but what we're told is that we're supposed to come to work if we don't have symptoms. So.
And now they have.
That's what we do.
Now they have a list, and if you're on the list, you're out for 14 days. So they've been going around in the last couple of weeks, and that's why I think there's more than 80 people that are out now that have either been in contact with somebody or been exposed in some way, and they're out on administrative leave for 14 days, even until their test results come back, I think. But I think if the test results come back, they have no symptoms, they can come back to work. But that's why we're shorthanded right now, really, at the hospital.
The previous practice has been that they...
Rob and I's coworker...
Go ahead, Cindy.
Go ahead. Rob and I's coworker that was positive wasn't even notified that he was exposed, and now he's sick, and he's in the ER today.
Thank you, Cindy. I was just going to say that there isn't a clear requirement for notification of exposure, so it's unclear whether people have been exposed or not. Also, it begs the question of how good the hospital's symptom checks are. If people are getting past those symptoms checks into the hospital working. So that begs the question for sure. Faye, did you want to follow up?
Stacy, I think we've seen throughout the pandemic employers shift positions where one, they're saying, well, if you don't have any symptoms, just come to work, even if there's a potential exposure. Or early on, no, people shouldn't wear masks and other very ridiculous things. Stacy, did you have a little bit of information about what workers you're hearing from workers around them being told to come into work and such?
Yes. So workers, as you can imagine, are fearful of their lives right now. They're fearful of taking a virus home to their families, spreading it out through the community. And having notification would be ideal, but they unfortunately are not receiving that. And the hospital should be reporting these and to facilitate any effective interventions to stop this spread. in Kitsap County. Workers have small demands, but are big to them. Just that they're notified that they can take time off so that they don't have to go back and forth into the hospital and spread this to their community, to their families. It's not a big ask. It's just extra measures that they should be taking to stop the spread.
Thank you so much, Stacy. And in fact, Rob went to work last night and had not gotten his results yet, and was told to use his best judgment. Okay, Cindy, go ahead. You're on mute. You're on mute, Cindy.
I just got a text from the Department of Health worker that went there today. She just texted me that she's in employee health right now, and my test came back negative. That's from the Department of Health. I was not notified by the hospital, and I got my test last Thursday.
Okay, thank you so much, Cindy. Obviously, there's a breakdown, and the hospital is telling one story and workers are telling another. And it seems like today people should be listening when workers are speaking up. So I want to thank everybody for attending today. Thank you to Cindy. Thank you to Rob. Thanks to Anna. Thank you to State Senator Emily Randall. And thank you so much to our president, Faye Gunther. If you have questions, you can follow up on this with us. Thank you so much.